In 1952, 5 doctors sat down in a room to answer one question. A new drug could cure syphilis, the disease killing hundreds of black men in Alabama. The question was whether to give it to them. These men did not know they were sick with syphilis, a disease that can slowly damage the heart and brain over many years if it's never treated. For 20 years, they had been told a different story. Nurses called this disease bad blood, an old phrase black families in Alabama used for many kinds of sickness. These men called the care they received from doctors the government treatment. They believed doctors were helping them get better. They got free rides to the clinic. They got free meals on the days they came in for checkups. They were even promised money for their own funerals, so their families would not have to pay for one. Not one of these men knew that a real cure already existed, sitting just out of reach, in the very doctors' bags that came to examine them. In that room, in 1952, the 5 doctors were not asking whether the new drug worked. They already knew it did. They were asking something else. If they cured the men now, the study would end. 20 years of watching this disease would be over. So the real question in that room was simple. Was saving these men worth stopping the study? To understand how 5 doctors reached that question, you have to go back to where this all began in 1932. The Public Health Service, the government agency in charge of keeping Americans healthy, came to Macon County, Alabama with a real problem. The county was in the middle of the Great Depression, a time when banks failed, jobs disappeared, and government money for health programs dried up fast. Before this study began, the Public Health Service had actually been running a program to treat syphilis in poor black communities in the area, and it was working. But that program needed steady funding, and the funding was gone. So officials made a choice that felt practical to them at the time. If they could not afford to cure the sickness, they could still learn from it. They could watch what syphilis does to the human body over many years, since no one had ever studied that closely before. 600 men from Macon County agreed to join, though none of them understood what they were truly signing up for. Most of these men were poor farmers who did not own the land they worked, and many of them had never once seen a doctor in their whole lives. When someone in a clean white coat offered them free medical care, it was not a hard choice to make. 400 of these men already had syphilis. 200 did not, and were only there so doctors could compare sick men to healthy ones. From the very first form these men signed, something quiet but important happened to how they were seen. On the paperwork, they stopped being men with names, wives, and children. They became the syphilitic group who had the disease and the control group who did not have it. That kind of label does real work inside a person's mind, even without anyone meaning it to. A patient has a face you remember. A patient has a family waiting for him at home. But a member of a group is just one line inside a bigger report. People do not lie awake worrying about a group. They worry about a person. Many of the doctors who ran this study were not cruel by nature. Many truly believed the science mattered and that what they learned might someday help thousands of other sick people around the country. But somewhere in those early years, they let themselves believe the group on paper mattered more than the individual men living inside it. By 1945, a new drug called penicillin was already saving soldiers' lives on battlefields around the world. By 1947, doctors everywhere agreed it was the best and fastest cure for syphilis. Everywhere, that is, except Macon County, Alabama. The Public Health Service did not simply forget about these men once the cure existed. They took real, deliberate steps to keep it away from them. When World War II began, the local officers in charge of picking men for the army were quietly given a list of every man in the study and asked to excuse them from military service. This was not an act of kindness. A military medical exam would have found their sickness right away and led straight to treatment. And the officials running the study did not want that to happen. A local nurse named Eugene Rivers, a woman the families in Macon County trusted deeply, kept detailed records for the study for decades. She drove the men to appointments herself and knew many of their children by name. Those records later showed something troubling. Officials were watching closely for any man who managed to get penicillin from an outside doctor on his own, and stepping in to stop it whenever they could. Then came 1952. 5 senior doctors from the Public Health Service sat down together to decide what happened next. Curing the men now with a drug that plainly worked would mean ending a study that had already run for 20 years. One of the men in charge, Dr. John Heller, later explained the thinking behind the choice in just a few plain words. He said, the longer the study went on, the more useful the final information would be. So the doctors in that room voted to keep going. Nobody in that room spoke up loud enough or long enough to change the outcome. A psychologist named Philip Zimbardo spent years studying exactly how a room full of decent people can reach a vote like that one, and he wrote the book explaining it, The Lucifer Effect, and the link for the free audiobook for it is below in the description. Philip Zimbardo gave this pattern a name. He called it dehumanization through abstraction, which simply means treating a real, living person like an idea on paper instead of a human being standing in front of you. In his research, he found something troubling and remarkably consistent. Ordinary people, the same kind of people who would never hurt a stranger standing right in front of them, will approve terrible harm to an entire group once that group has been shrunk down into a label, number, or a single line on a form. The label quietly does the hard moral thinking so the person no longer has to do with themselves. Dr. Hiller and his colleagues were not unusually evil men compared to anyone else. They were doctors who had spent 20 years reading memos and sitting through meetings that slowly trained them, one small step at a time, to see the syphilitic group instead of seeing Charlie Pollard or Herman Shaw or any of the real names whose names filled Nurse Rivers' notebooks. Zimbardo's research also uncovered something else worth knowing. This kind of slide almost never happens in one big dramatic leap. It happens through many small, ordinary steps spread out across years. One form here, one label there, one meeting where continuing on feels safer, more responsible, more scientific than simply stopping. By the time a real life or death decision finally arrives, the people described on the page no longer feel like a decision worth wrestling with at all. Somewhere in Macon County, a man approaching his death is still calling it the government treatment. He still does not know the real name for what is happening slowly inside his body. He still believes, because he was told to believe it for 20 years, that someone out there is taking care of him. Maybe today he got another free ride to the clinic. Maybe a nurse smiled at him and told him he was doing fine. The nurses are still using the old familiar phrase. The papers in his file still say bad blood. What has quietly changed is the file sitting behind a door he will never see. In that file, his name has already turned into a number inside the syphilitic group. And in a room he will never enter, 5 men have already decided, calmly and on the record, that finishing their study matters more than curing him. He will keep waiting for help that was never actually coming his way. And somewhere, right now, in some quiet office far from where he sits, someone else is filing out a form that looks exactly like his, but with different words.